Welcome back to BSA by Design, a podcast about transforming healthcare, educational, and research facilities through expert design and insight. I'm your host, Brian Moore. This episode of the show is unique in that we don't have an in-studio guest. Instead, we're going to peek behind the curtain a little bit to look at how we work internally and share expertise. Part of the culture at BSA is to be partners and ideal team players and to share knowledge across the firm. We don't expect everyone to be experts at everything. And what makes BSA unique is that we do have our experts, but our experts are very good at different things. So we have design and learning labs at our studios to share that expertise with younger staff and help them grow professionally. This is how we teach staff and learn about expertise and new project types across the healing, learning, and discovery markets. So this episode doesn't follow an interview format. And what you'll be listening to in a few minutes is a real recording from one of our recent Indianapolis studio design labs, where Kay Townsend and Evan Steckler walk through different components of a discovery project and the designing of these spaces from an architectural and engineering perspective. First, I'll be joined by Kay, Scott Allen, and Matthew Jeans to introduce what kind of project that you'll be hearing about in the design lab, and that's really just for your own context. Kay Townsend is a planning principal at BSA, while Scott Allen is our learning and discovery practice director. Matthew Jeans is a principal, and Evan Steckler is a mechanical engineer too. You can connect with them all on LinkedIn.
Thanks for joining me. I just really wanted to set up what we're about to listen to in terms of the Indy Studios Design and Learning Lab that occurred recently, and just maybe set up what folks are about to hear and the types of projects that we work on in terms of the overall efforts that we've been doing over the last few years.
Radioisotope research and production is really starting to boom right now. I mean, talking with many clients, they see that we are just beginning to scratch the surface of the abilities of these isotopes. So I think it is a type of architecture and research that we're going to see continue to grow and spread throughout the country and the world. You kind of have a few types of isotopes, and for those that don't geek out and get nerdy and everything, sometimes if you think of an isotope as a neutron, so that there are different types of neutrons, and these neutrons actually can attach to certain elements. It can allow researchers to kind of trace food through the body, or in one client's work, we're helping them. They take these isotopes and they bind them to certain targets, and then they can target certain cancers. So they can take that cancer drug and get it exactly where it needs to be. So it's a very targeted type of treatment for these patients. You see it on the sort of radio pharmaceutical, medical health kind of arena, and then you see it in the research arena. We have the private clients and then the higher education clients that we're seeing that more for research. While the spaces themselves operate very similarly, higher ed clients kind of want to keep it more open for the type of isotopes they may want to have or produce in their clean rooms and within these hot cells, because they never know where the research is going to lead. Whereas your pharmaceutical clients are very targeted and they have this specific isotope that they use for cancer treatments. So while the spaces themselves operate very similarly, kind of the supporting spaces may be a little bit different for each type of client.
Well, Brian, BSA is really set up for this and this understanding because of our lab planning expertise, but not only that, but we're an integrated firm. And being integrated really kind of brings our solutions that come from both engineering perspective and architecture perspective as well. And that's really important because we have that understanding of how these labs work at all those kind of different junctures, whether it be a clean room, whether it be a hot cell space, whether it be the lab itself. And then we look at the holistic kind of planning of the building from that perspective. And so I think what you hear in this conversation that takes place during the learning lab really is an important piece of that kind of conversation around the idea of how we work as a firm, what kind of, protections are needed, what kind of ventilation's needed, what kind of different power requirements, all those different utilities that go into it are really kind of complementary. And I really think it takes an integrated firm to kind of do this work. I think it's challenging to do it if you had separate entities involved, working hand in hand with each other. As you'll hear in the conversation with Kay and Evan, is really the way it works the best. Our clients really see kind of a little bit more of a smoother process, and it really allows us to understand it in a complete way. If you had a consultant that was doing it, it would be a different experience. And I think it would be actually harder to kind of coordinate, harder to figure out, and ultimately harder to implement through that process.
We provide value. We bring expertise to the table in that we've picked up from the pharmaceutical side, bringing that to the higher ed side, and how that knowledge can complement their technical knowledge of production and processing of isotopes.
I think that kind of experience is one that you need to have as a full circle understanding of this, because there's different chains of custody. There's different ways that this is used, but to do responsible science research and understand how that is planned and designed for is having that kind of breadth of experience. I'd also say for us, it's sort of that idea of what's kind of the new thing nowadays, or the thing that's going forward, is this idea of open science. And to whatever degree we can share what we learn from either side of that spectrum to the other side of the spectrum is really important.
I think BSA, in these relationships, we sit as a bridge between the pharmaceutical and the higher ed, like the research reactor side. So we're bringing the knowledge we have from how the pharmaceutical companies work to how the research reactors work, and bringing those together into allowing the one to influence the other back and forth.
And with that, let's listen in as Jackie Beegler, our design principal in Indy, opens up the design lab.
Today's design lab is intended to talk kind of in general about radioactive lab research design. We've got a recent project here in Indianapolis where it's heavily involved with radioactive material. And the thought was that between Kay and Evan and Matt, they could speak a little bit more in depth about what kind of strategies need to be studied, explored, and possibly implemented on some of these projects, because from material handling to personnel and control areas, just how you need to be mindful how that material like radioactive isotopes and different other radioactive stuff needs to be addressed. So with that, Kay, I'm going to kick it over to you, and then Matt and Evan, you guys can weigh in as you proceed.
Okay, so I thought maybe we kind of start with like, what is a radioisotope? So, and this is beyond my science here, that is about as far as I go with the science, but basically a radioisotope is an isotope that has been bombarded with radiation of some sort. So they kind of use hydrogen as the example. So like hydrogen has its electron and its proton, and then you change its sort of function by adding different neutrons. And then that's what makes it a radioisotope. And then they emit radiation, and they use that for scientific and medical purposes. Once it's radiated, the isotope requires further chemical processing to isolate it and purify it into the needed form, as they have a short shelf life. As I mentioned, they're used to study and treat cancers. It's a very targeted therapy. And you can kind of see the little red isotope that they attach to a targeting ligand. And then that ligand is what is specifically, I don't want to say programmed, but they find this ligand that will go to a specific cancer type. And so they are then able to infuse this mixture into a human body, and it will go straight to that cancer and treat that cancer, kill that cancer, and not affect the adjacent cells and everything. So it's very precise radiation delivery, very targeted, has fewer side effects. But the one reason that I'm really interested that we get into this sort of realm of design is that it was a $7 million market in 22 and expected to hit 13 or $14 billion, in the next 6 or 8 years. As one of our clients said, they've just now started to scratch the surface on what this type of research can do. So why are these facilities different and expensive? They require stringent safety regulations. So while we know high level what some of those are, we do rely on the client's radiation specialists to kind of help us with those a little bit. They require highly trained personnel to work on these and specialized equipment. So then that also means specialized construction for when you're holding some of this material and waiting for it to decay. Obviously, we've got clean room areas because if you're dealing with anything from medical, you've got FDA and clean room protocols that you have to follow. And one reason they're expensive and they're building these is typically this materials come from overseas. And that's one of the big pushes here in the U.S. is to bring that kind of production to the U.S. or from there. And the short half-life of the material limits the storage and necessitates constant production. But the lack of economy of scales, really in the small market segment at the time also makes it very expensive. You've got specific ways that you have to get rid of the waste and specific vendors that take what they call that hot waste. And then working with, in the medicines and treatments requires FDA approvals and GMP processes. So some of the reasons, high-level reasons that these facilities cost so much. So where to start? It's a very process-oriented layout. We always start with sort of that workflow, and we determine the clean room classification strategy. Every client is a little bit different. Like I said, it's very process-oriented. We kind of took this targeted approach of the workflows and allowed that to sort of dictate where spaces were. Some of the other design considerations, it's the weight of the equipment, but in the end, there's quite a bit of weight on a facility. So there's a lot of cost when you think about, quadrupling up sometimes on the slab if it's 12 inches when we might normally have like a 4-inch or something.
So I want to talk about a couple of kind of interesting things. I'm always fascinated by nuclear stuff. And so when you hear like, oh, there's radioactive material on your project, it's kind of like, well, what does that really mean? Like, how radioactive are we talking? Because like in hospitals, we have nuclear medicine spaces that'll have hot cells in them from time to time. But so at this facility, basically what they do is, they shoot neutrons at a particular ytterbium isotope that turns it into this lutetium-177, which is the product that they produce. And then that will decay until it reaches a stable isotope of hafnium-176 or something like that. And so that the isotope emits both beta particles and gamma rays. So obviously, if you're familiar with this at all, gamma rays are the most, the highest energy type of radiation that sort of naturally occur from various radioactive isotopes. But the gamma radiation we're dealing with for this product, which I would assume is probably fairly similar to a lot of other radiopharmaceuticals, is fairly low energy. And so when you think of a nuclear reactor and the kind of concrete and then lead shielding that is involved in that, this is significantly less. So the gamma emission that comes up that's produced by this product is to 200 kiloelectron volts. You need less than 1 centimeter of lead shielding to basically completely attenuate the gamma radiation produced by this material. And the beta emission, which is generally less harmful, it's kind of medium energy beta emission, 500 kiloelectron volts. It can be completely attenuated by like a thick plastic or even a few millimeters of aluminum. So basically anything that would be like, if you had contaminated particulate matter in your ductwork, the duct itself would completely block that from escaping. And the gamma emission it all decays fairly quickly. And so it's not actually a high level of radiation, but obviously we still have to consider that throughout the design. So if you go to the next slide, so obviously there's where the product is, wherever it is, it's going to be emitting beta particles and gamma rays in the energies I described. But then the question is, okay, what about the HVAC system? And what does that mean for how we handle the exhaust air? And so the question I was asking initially is like, okay, how does the air become radioactive? Like how does the air become contaminated with radioactive material? And really there's three ways that this could theoretically happen. And the first is called neutron activation, which initially I was concerned about. But turns out that can really only happen kind of inside of a nuclear fission reaction in a reactor or a nuclear bomb or something like that, where basically bare neutrons are being ejected from the radioactive material, and they can actually turn something like an oxygen molecule or a nitrogen molecule in the ambient air into a radioactive isotope that would have a very high energy, emit gamma rays to a significant degree. But that we don't have that kind of radiation happening, as is produced by this radiopharmaceutical. So that's not an issue. The oxygen and the nitrogen in the air themselves don't become radioactive. The other thing that could happen is if you have a product that has a gaseous isotope in its decayed chain, that radioactive gas could obviously get mixed in with the exhaust air and could become problematic. And so this is very common in some facilities where a radioactive iodine isotope is in the decayed chain that is gaseous, so then that can make it into the airstream. But the decayed chain for lutetium-177, it's all solids, so none of it becomes a gas at any point. So you don't risk having any radioactive gas in your exhaust airstream, which would need to be absorbed by a very specialized carbon filtration. So that only leaves one way that any of this could get into the airstream, which is particulate contamination. So even in a clean room environment, there are microparticles, dust of various sizes in the air. And if there were to be, in particular, a spill of any kind of the product, whether it's inside the hot cell or in one of the storage areas, it's fairly unlikely based on the way they store this and on the way they handle it. But if that were to happen, some of the radioactive drug atoms essentially could end up finding themselves getting attached to dust that could then be caught up into the exhaust airstream. So that is the condition that we actually do have to be concerned about. And that's the only way we could really deal with that is just high efficiency particulate filtration. So filtering out any particles that could have radioactive isotopes basically stuck to them is how we prevent any radioactivity from escaping the building in the exhaust system. So what we have are basically all of the exhaust systems that serve spaces that could possibly have a spill occur. It's all run through a bag in, bag out exhaust train.
And something that I didn't mention that I think is pretty interesting is like they have radiation detection equipment everywhere. They have air monitors on the walls inside the clean rooms. They have hand and foot monitors that anytime you come and go from the spaces, you have to be measured basically to see if you have any particles on you. And they have a whole body monitor that they have to walk through anytime they exit the space. So lots of different monitors and everything throughout the facility to kind of double check and make sure there's no contamination.
Spills would be very small volumes. We wouldn't really expect a significant amount of particulate matter to really ever be exhausted through these systems. If this were like a nuclear power plant facility, these bag in, bag out filter assemblies would need to themselves be inside of a lead-lined space, because obviously they're catching radioactive particulate matter, then they've got radioactive stuff in them. But here the radiation level is low enough, the odds of a significant spill are low enough that that was not a case. The other aspect is really drainage of the sanitary system. So really, there's only one place. I guess really two places where we might expect some sort of spill to make its way into the drainage system. One is the autoclave, that 40-ton section of the hot cell that they're using to, I guess, sanitize the final product. Basically, the autoclave drain dumps into a holding reservoir that is continuously monitored for a level of radioactivity. And then if it happens to be above a certain level, it will discharge that water via some motorized valves into our containment drainage system that's sent out to a 30,000-gallon underground tank out on the site. If there's no radiation detected, which we would expect would be normally the case, it can go straight into the sanitary sewer system. And then the other place is the emergency showers, obviously. If there was some sort of a spill and someone were to be in one of those showers for 15 minutes, we sent all those floor drains underneath those to the containment tanks as well. And then in fire sprinkler containment, there's a containment drain that is it's normally closed. So it's obviously we're in a clean room. We don't want open drains all over the place. So it's got a cover that you remove with suction cups. If there were to be a fire sprinkler discharge or a larger spill, you could come and remove those lids and give that place to drain to.
Having any radiation that might get into the groundwater or anything like that. So I think it's also a client-specific requirement, and their radiation safety folks will give them sort of specific guidance on that.
Yep. So just really quick here. So one of the kind of unique challenges about this is that a clean room, they're producing a pharmaceutical product that's going to be injected into people's bodies, but it's also radioactive. So we want to protect it from, any contaminants and also prevent the product from contaminating anyone or anything in the building. And so the way we kind of approach this is by essentially having a space, the production room, that is negative to an airlock to prevent anything from getting out, but that has a positive pressure sort of buffer that prevents anything from getting in from the corridor into the space. So this corridor is positive in relation to this airlock. And so we wouldn't expect any air to make its way in from corridor all the way through into the production area. But we also wouldn't expect air to make its way out into these pressure relationships. We do have this emergency airlock, which is obviously only used if someone needed to escape the room as quickly as possible, go through 2 doors instead of 4. And this room itself is just very negative, so that if these doors were opened, it kind of creates this negative pressure vacuum between the corridor and the production space that would hopefully prevent contamination going either direction. That's kind of an interesting thing. Don't want the radiation getting out, but don't want anything else that's getting in.
All of those airlocks have interlocks. So when you go into one, you can't open the door of the other one until the other one's closed, and they'll have lights for that.
So a lot of times on projects, we'll sort of measure the differential pressure against, it's always relative to adjacent spaces, but the way that I guess they do it in Europe generally is there's a common reference, and in this case it's the corridor, so that's 0 PA, and all of these other pressures are in relation to that.
I hope you enjoyed this unique episode. If you want to learn more about BSA, our expertise, and our work, visit our website at bsadesign.com. There's a link in the show notes to contact us as well. Be sure to subscribe to BSA by Design on Apple Podcasts, Spotify, and YouTube Music so you don't miss an episode. We've got more content and project stories to share on social media, so be sure to follow us on LinkedIn, YouTube, Facebook, Instagram, and X. That wraps up this episode. Join us again next time on BSA by Design.